Good afternoon, and welcome to this briefing for the House Health and Government Operations Committee. We are also joined today by the House members of the Joint Audit and Evaluation Committee. This is a virtual committee briefing. Consequently, I ask for your patience if we encounter any technological or streaming issues. This briefing is being streamed on the Maryland General Assembly's YouTube channel. Committee members will be muted throughout this briefing. If you have a question after the presentation, please use the raise hand function, which is located either underneath the participant list on the right side of your screen or under the reactions bar at the bottom of the screen. I will call on delegates to ask questions. Remember, even though we're meeting on Zoom, please adhere to our usual committee rules of one question and one answer from one panelist, not one question and one answer from each individual panelist. Also, please keep your questions shorter than the expected answer. Today, we are being briefed by representatives from the Office of Legislative Audits on their December report, review of certain emergency procurements related to the state of Maryland's COVID-19 response. Representatives from 5 agencies whose emergency procurements were reviewed in this report are also on the call, and they are available to answer questions, but they will not have a separate presentation. It is our goal to conclude this briefing close to 2 o'clock. As a reminder, the Health and Government Operations Committee will hold bill hearings at 2:30. Gregory Hook, Director of the Office of Legislative Audits, please begin.
Good afternoon, Chairman Rosenberg and committee members. I'm Greg Hook, the Legislative Auditor, and today the Office of Legislative Audits, or OLA, will brief the committee on the results of our review of certain COVID-related emergency procurements. With me today are Josh Adler, Assistant Audit Director, Eddie Rubenstein, Audit Manager, and Joe McWilliams, OLA's Fraud Investigation Manager. After my introductory comments, I will turn it over to Eddie to present our detailed findings. With your permission, I'll provide some brief background on this review. In June 2020, this committee and the Senate Education, Health, and Environmental Affairs Committee jointly requested OLA to conduct a review of the emergency procurements specifically awarded to Lab Genomics for COVID tests and Blue Flame Medical for medical supplies. The results of that review were reported upon in a special report dated March 31st, 2021, wherein our primary finding was a pervasive lack of written documentation to support the key aspects of the procurement, use, and validity of the test kits. And we concluded that the test kits were not procured in accordance with state procurement regulations. During that review, other emergency procurements related to the state's COVID response came to our attention. Eventually, we identified almost 850 emergency procurements conducted by state agencies during the period between March 2020 and May 2021, totaling approximately $1.7 billion. In response, OLA undertook a second review of additional emergency procurements, 15 to be precise, and it is the results of that expanded review's December 13th, 2021 report that we are presenting today. These 15 included 14 additional emergency procurements in addition to Blue Flame Medical, which were conducted by 6 state agencies. As in our initial March 31st, 2021 report, in general, this second review noted a lack of compliance with state regulations for emergency procurements and ineffective monitoring of the related payments. Although we readily acknowledge the urgent and unique circumstances under which these procurements were made, such conditions would not mitigate the need to properly document and comply with state regulations specifically tailored to or required of emergency procurements. These conditions also would not mitigate the need to ensure the purchased goods or services were received and met applicable requirements, and when practicable, document the disposition of the items purchased. With respect, I would like to make one final statement before turning the presentation over to Eddie. As you may be aware, the issuance of the March 31st report resulted in a very public allegation that the OLA's report was partisan nonsense. You also may have noticed that the OLA's response to this claim was silence. The OLA does not issue press releases. We have no public affairs officer, and in fact, we shy away from speaking with the press. we let our fact-based audit reports speak for themselves. I assure each of you and all members of the Maryland General Assembly that OLA audits and reports its findings with complete independence without regard to politics. In my over 40 years of service in the Office of Legislative Audits, no matter the executive branch administration, OLA's only goal has been and remains to promote government accountability. I believe that then Senate President Mike Miller, in a March 1991 Washington Post article, summed it up nicely when responding to Governor Schaefer's criticism of the legislative audit process. To quote, "The executive branch does not like to be criticized, to have the books looked into. An important function of the legislature is administrative oversight to make sure that people's dollars are spent wisely," unquote. With that, I will turn it over to Eddie Rubenstein to walk you through the handout.
Good afternoon. Can everyone hear me?
Yes.
Okay. Good afternoon, members of the committee. My name is Eddie Rubenstein, and I was the manager for this special review. As Greg mentioned a moment ago, this is our second special review of emergency procurements related to the state's COVID-19 response. The scope of our first review is shown on slide 2, and the results are summarized on slide 3, including the procurement issues that Greg touched on in his introduction. As noted on slide 3, although we requested documentation of test results from the labs that used the lab genomics test during our first review, our request for this documentation was initially denied, and access was not provided with enough time for us to include in our analysis for the initial report. The purpose of requesting this data was to verify certain assertions made to us regarding the reliability of the test and the number of tests that were used. Moving next to slide 4, our current review had 2 objectives. The first was to assess the procurement and accountability of additional emergency procurements associated with the state's response. And the second was to account for the number of lab genomics tests used and to corroborate an allegation we received regarding concerns with the accuracy of the test for samples collected at Towson University. Next, slide 5, please. As Greg said in his introduction, during our first review, we became aware of other emergency procurements related to the state's COVID-19 response. And eventually we identified 848 emergency procurements conducted between March 2020 and May 2021. These procurements were made by 19 state agencies and totaled $1.7 billion, of which $1.3 billion related to emergency procurements made by the Department of General Services and the Maryland Department of Health. The 15 emergency procurements that we reviewed for this special review totaled $233 million and were conducted by 6 agencies: the Department of General Services, the Department of Public Safety and Correctional Services, the Department of State Police, the Maryland Department of Environment, the Maryland Department of Health, and the Maryland Emergency Management Agency, which I would note has since been renamed as the Maryland Department of Emergency Management. Moving to slide 6. Our presentation lists the agencies that were responsible for procuring and monitoring the 15 emergency procurements we reviewed, along with a description of the goods or services purchased and the related prices. Today, I'm going to present an overall summary of the results of our review and then discuss our findings for 2 of these procurements in greater detail. Before I get into the results, I first wanted to provide a brief overview of state emergency procurement regulations, which are summarized on slide 7. Under these regulations, state agencies are authorized to procure goods and services using the emergency procurement method when faced with an emergency. According to regulation, an emergency is a sudden or unexpected occurrence or condition which agency management reasonably could not foresee that requires an action to avoid or to mitigate serious damage to public health, safety, or welfare. It should be noted that the use of the emergency procurement method does not require a formal state of emergency to have been declared by the governor. In this regard, a report issued last January by the DLS Office of Program Evaluation and Government Accountability found that most emergency procurements were unrelated to a broader statewide emergency. Furthermore, a declared state of emergency does not limit agencies to using only the emergency procurement method. Rather, agencies are responsible for determining when to use this method on a case-by-case basis and determining whether it's justified or not. And then lastly, the regulations include certain requirements for emergency procurements, including a formal written contract, obtaining competition, notifying the Board of Public Works, publicizing the award, and documenting the details of the procurement, including the basis for selecting the vendor. The summary of our review of these procurements begins on slide 8. Generally, we noted a lack of compliance with state regulations for emergency procurements and ineffective monitoring of the related payments. Specifically, we found that 11 of the 15 procurements we reviewed were not in compliance with one or more state procurement regulations. For example, 3 of the procurements lacked a formal written contract, and the contracts for the other 8 procurements lacked critical provisions required under state procurement regulations. In addition, the agencies responsible for these procurements generally cannot provide documentation to explain key details of the procurements, such as how the vendors were identified and selected. We also noted that 7 of the procurements were made from vendors that were not registered to do business with the state, and the procurements were not always reported to BPW or publicized within the required timeframes. Our review also disclosed that 7 of the 15 emergency procurements were not effectively monitored. For example, we identified payments totaling $25.5 million made under 4 emergency procurements for which the responsible agencies could not document that the services had been received and the payments were in accordance with the contracts. We also identified payments totaling $3.3 million on 2 emergency procurements for which the agencies could not document that all items had been received, and payments totaling $1.7 million related to another procurement of ventilators that were not operational at the time of our review. Continuing to slide 9, for the 7 emergency procurements of personal protective equipment, we noted that documentation cannot be provided to support that the items were inspected to ensure they were legitimate. While we were advised that the items were visually inspected to ensure they were undamaged, agencies that received these items could not document any additional steps taken to verify their legitimacy. In our opinion, these inspections were warranted given that the intended use of these items was to protect Marylanders from the virus, and several of the purchases we reviewed were from vendors whose primary business did not appear to involve manufacturing or selling medical supplies and equipment. We also could not determine the disposition of certain items valued at $7.6 million purchased under 5 procurements. Specifically, the inventory records we were provided did not indicate whether the items were on hand or had been distributed to other entities, and the items could not be readily located at the time of our review. For example, MDH could not document that it received 2 million KN95 masks for which it paid $3.3 million and could not locate 27 ventilators with an associated purchase price of about $1 million. A summary of our findings for each of the 15 procurements we reviewed is included on slide 10. And I'd like to now discuss 2 of the emergency procurements we reviewed in more detail, starting on slide 11. This is the procurement of N95 masks and ventilators from Blue Flame Medical that we reviewed at the committee's request. In April 2020, DGS issued a $12.5 million purchase order on behalf of the Maryland Department of Health to Blue Flame for 1.55 million N95 masks and 110 ventilators. DGS paid $6.3 million as an initial deposit. However, in May 2020, DGS canceled the purchase and attempted to recover this deposit because the items had not been delivered. Ultimately, DGS reached a settlement with the vendor in October 2020, which allowed Blue Flame to keep the initial deposit as payment for the masks and ventilators that were eventually provided to MDH. Moving on to slide 12, our review of this procurement disclosed that DGS did not procure the contract in accordance with state procurement regulations. For example, the purchase order issued to Blue Flame Medical did not include certain required provisions, such as dispute resolution. The omission of these provisions was significant given that litigation was ultimately required to obtain the masks and ventilators. We also found that Blue Flame Medical was not registered to do business with the state, and the procurement was reported to BPW and published on eMaryland Marketplace after the deadlines provided for in state regulations. Our review disclosed that MDH did receive 1.55 million N95 masks and 37 ventilators in accordance with the terms of the settlement agreement. Although MDH inspected the ventilators and determined they were operational, MDH could not document that it had inspected the masks provided by the vendor. MDH also could not explain the disposition of 475,400 of the N95 masks that were purchased from Blue Flame with an associated purchase price of $2.1 million. Specifically, MDH could not locate these masks when we conducted a physical inventory of its warehouse in July 2021, and MDH inventory records did not indicate that the masks had been distributed. The second emergency procurement I'd like to discuss is the procurement of consulting services from Ernst & Young, or EY, which starts on slide 13. MDH awarded this contract in January 2021 as an emergency contract with an initial value of $3.8 million. The contract required EY to conduct a comprehensive assessment of the state's COVID-19 vaccination program to identify the additional steps MDH needed to take to effectively administer the program. The contract also called for EY to provide 7 staff to support the program, with the provision that additional staff would be provided as needed to implement the recommendations EY made. MDH has modified the contract twice, which has increased the total contract cost of $47 million. Moving to slide 14, our review disclosed that MDH did not procure the consulting services in accordance with state procurement regulations. Specifically, the use of the emergency procurement method for this contract did not appear justified. As I mentioned earlier, state regulations provide that an emergency is a sudden or unexpected occurrence that agency management could not foresee. However, MDH was aware that it needed these services in October 2020, 3 months prior to when it initiated the emergency procurement. This delay is significant because rather than procure the services through a competitive procurement, in January 2021, MDH directly solicited proposals from 4 vendors and allowed only 36 hours for them to respond. As a result, we could not conclude that the selection of EY was the most advantageous to the state. MDH also cannot justify a $21 million contract modification processed in April 2021 that increased the total cost of the contract to $25 million at the time. Specifically, the modification did not identify additional EY staff to be provided or services to be performed to justify the increase, beyond a broad statement that additional personnel were needed to effectively and efficiently implement the program. MDH also cannot explain how the dollar amount of the modification was calculated. Although we noted that the number of staff provided by EY under the contract increased from the initial 7 to 93 employees between January and April 2021, MDH could not document the need for these individuals nor the tasks that they were to perform. Our review also disclosed that MDH did not adequately monitor this contract. As a result, certain deliverables were not received and certain payments were not in accordance with the contract terms. Specifically, we noted that the comprehensive assessment conducted by EY did not provide specific actions or identify the staff needed to do the work as required by the contract. Although this assessment did contain a total of 22 recommendations to address the various issues identified with the program, it did not identify the specific actions EY was to take to implement these recommendations, nor did it identify the number of additional EY staff needed to perform the work. Finally, MDH could not document that it had approved the EY employees that were billed for and did not obtain documentation of the work completed by each employee as required by the contract. Accordingly, we could not verify the propriety of the billings, which at the time of our review totaled $3.7 million. Next, on slide 15, is our second objective, which was to account for the number of lab genomics tests used and to corroborate an allegation we received on our fraud, waste, and abuse hotline in September 2020. The allegation regards concerns with the accuracy of the test results received for samples collected at Towson University. We obtained the test results from the various laboratories that used the second set of 500,000 test kits purchased from Lab Genomics that were the subject of our initial review. As previously mentioned, we were unable to obtain these test results during that review. Based on our current analysis, we determined that 92% of the Lab Genomics tests were used to analyze patient samples. The labs that used the tests advised the remaining tests were likely used for other purposes, such as validation studies and test controls. Our analysis also generally corroborated the concerns raised in the allegation made to our hotline. Specifically, the individual who made the allegation advised that the test results for samples collected by Towson University in August 2020 and sent to the University of Maryland Pathology Associates for analysis were positive for 66 individuals, but that certain of these individuals challenged the validity of their test results, immediately retested, and received a negative test on their second test. a negative test result on the second test. We determined that 42 of these 66 individuals did in fact retest between 2 to 6 days after their initial test was completed, and that 26 of these 42 individuals did in fact receive a negative result on the subsequent test. However, we could not determine if the inconsistent results were due to inherent performance issues with the tests themselves or other factors that could impact the validity of the results. Finally, our overall conclusions are on slide 16. Due to the nature of this special review, our report does not contain any recommendations. But to echo what Greg said in his opening remarks, we do recognize the urgent and unique circumstances surrounding these procurements. However, these circumstances would not mitigate the need to document and comply with state procurement regulations that are specifically designed for these types of emergencies. These conditions also would not alleviate the agencies of their responsibilities to ensure that goods and services were received and met applicable requirements, and to document the disposition of items purchased. This concludes our presentation on our special review. I'd be happy to answer any questions from the committee.
Delegate Kaiser.
Thank you, Mr. Chairman, and thank you all for this detailed report. I appreciated when Mr. Hook said that, obviously made the nuance point. Of course, these were tough times, emergency times that make things a little more challenging. And you also said, Mr. Rubenstein, at the end, not really recommendations, but what could it be? Was it a lack of staff, a lack of training? Do we need better computer systems? Do we need greater respect for the rule of law? Do we need more streamlined emergency procedures? Like what do you potentially see as solutions moving forward?
I think that for quite frankly, this is my personal opinion because we didn't really get into the concept of recommendations, but I think the agencies probably felt overwhelmed by the crisis. And they can answer that, they're on the line, but I think it was a all hands on deck situation, and they just felt they had to do whatever they could to get whatever they could whenever they could. But again, you know, I'm not sure how much more effort it would have taken to comply with some of these requirements. And the Ernst & Young, you had almost 90 days where you knew you needed these types of services. And there are procurement methods available that you could have used. Instead, as Eddie said, they hurried up and they did seek some competition, but they limited the amount of time for the respondents. So it's a myriad of causes, more likely than not. Eddie, do you want to add anything else to that, or Josh?
I think that's well put. I mean, we all remember what the world was like in March of 2020 and what the uncertainty was. You know, but like you said, Greg, the Ernst & Young procurement occurred in January of last year, you know, 9 months into this thing. So, you know, some of it may have been due to the initial overwhelmingness of the pandemic, but you know, in other circumstances, it was probably just a lack of adherence to the regulations.
I mean, a lot of the findings that we have here will not require additional staff, and they're just basic things that making sure that we got the service that we paid for, making sure that we got the goods that we paid for, making sure that they're published, that a reason why we picked this particular vendor. These aren't like outlandish outlandish findings that are like nitpicky auditor type findings. These are just, you know, everybody, if they have a house and something happens at the house, you know, you're paying a contractor, you want to make sure that you're getting the service before you pay them. Those were the nature of these findings overall.
Delegate Kittleman.
Thank you. Two questions. One, the governor waived a whole lot of regulations in a bunch of different departments. Am I correct in thinking he really doesn't have the authority to have waived some of the items that you are that they didn't do anything to do with DLS and procurement? And did he? And if so, was that legitimate, or should he have?
Well, to answer the first question, I'm not a lawyer, thank God. No offense to any lawyers on the committee. I apologize now that I realize what I just said. But I don't know what the legal abilities of the governor are to waive certain things. I don't believe in these cases, and Eddie could respond. I don't believe any of the agencies raised that as a reason why things happened the way they did. Is that true, Eddie?
That's correct. That wasn't raised as a defense, if you will. But I would also point out the reason that the emergency regulations exist in the first place is recognizing that there are circumstances where the normal procurement regulations can't be followed.
And that's my second question. Having been in administration, I'm pretty familiar with emergency procurements, and the typical emergency procurements are, light years away from what happened in the pandemic. And I wonder if we shouldn't, going forward, create a different set of regulations for pandemics and other sort of overwhelming issues.
I would reiterate, though, that it's the same issue. You want to make sure when you're paying for something, you want to make sure that you got what you wanted, what you're supposed to get before you pay for it. It's really whether there's an emergency or not an emergency. That's just basic common sense.
But the delegate, you're speaking of just speeding up the procurement. You're not talking about waiving the other things that Josh just talked about. You're just saying a way to speed up the procurement process.
Yeah, it just should be looked at all over. And I mean, while I respect what you're saying, there are times, and this is one of them, where everybody was so busy that the things that you're asking for just wouldn't come up. I mean, just take a look at the Department of Labor and what happened to it because of the.
You have a question, Delegate Kittleman?
Pardon?
You've had your question. Can you, a brief second question, which is more than we normally permit?
Well, I'm done.
Okay, thank you. Delegate Young, followed by Delegate Krebs.
Thank you, Mr. Chair, and thank you for your very extensive report. Given the extensiveness of these procurement violations and the minimal acknowledgments that I read in some of the department responses, even of kind of fundamental items you pointed out, what kind of enforcement capabilities exist to at least correct some of the low-hanging fruit and ensure that the more urgent violations don't repeat themselves?
Well, unfortunately, the Office of Legislative Audit has no enforcement authority. Our authority is just by virtue of working for the legislature. So it actually rests with you all, maybe through the budgetary process, whatever. But I think some of the responses, though, do indicate that the agencies acknowledged there were improvements that could be made. And I think the health department, for example, acknowledged that. And I think they committed to putting better processes in place or tightening existing processes. So, I'm not sure till the next time if they'll be fixed or not. But I do think there was a degree of cooperation ultimately from the agencies. And perhaps I think some of them are on the line. Maybe they could speak to that at some point in this hearing.
Thank you. I just found the number of times you contradicted their response to be a little alarming. Thank you.
Well, that was the factual accuracy maybe of what we were saying, but I think ultimately they did, again, I don't want to speak for them. I thought that they did commit generally to improvement.
Okay, thank you.
Krebs. I'm sorry, Delegate Young. Delegate Krebs.
Thank you. And I have two quick questions. The first one, I know this committee passed a bill last year on procurement to try to fix some of these things. And I don't remember the details of it, but I'm not sure if you're familiar with the bill. Would that bill have addressed these issues? And if they did not, what else can we do? I know you didn't have any specific recommendations, but given that we have that now in place, that bill, and then what could we do now today?
Well, we did actually talk internally within the office about that issue. And the two things that came to our mind was that and Josh and Eddie, you can jump in if I recall this incorrectly, was that perhaps having some type of time limit on how long an emergency procurement contract could exist. That might be something worth considering. I'm not sure what that time limit is. And then when you renew an emergency procurement, depending upon the length of the original contract, perhaps you're able to do some type of competitive procurement at that point, because you can plan far enough ahead at that point in time. If the original contract was a year or 9 months, well, certainly at the 6-month point, you should know if you're going to need those services further. Perhaps then there could be some type of competitive procurement instead of just continuing and renewing that contract over and over again for an extended period of time. And then I also think there may be a disconnect between state procurement regulations and state law with regards to the definition of an emergency procurement. Eddie, do you want to jump in on that?
Sure. So I believe the change from the bill you're referring to, Delegate, slightly altered the definition of what an emergency is in statute, and specifically it removed the requirement that it be something unforeseen, or something that could not have been anticipated. So the concern would be that, similar to using the EY contract again as an example, that agencies could just delay and delay and delay until the point where it was actually an emergency. Whereas the definition we use for our review is what's found in regulation, which says that it does, in order to use this method, it has to be something that agency management could not have reasonably foreseen.
Thank you. And I'm just looking for opportunities to fix this, but my one other question is a little bit open, and I'm just hoping I see on the agenda, it says available to answer questions, and there's folks from the Department of Health and Corrections and Emergency Management and General Services. And I'm very hopeful that you all will respond in some way, not necessarily to a direct question, but just tell us what's being done within your agencies as a result of what the findings were, to give us some confidence that you all have been these unprecedented times, have taken these examples to heart and have put things in place to make them not happen again. So I'm hoping it's a very broad question, but I'm hoping that this available to answer question, that's a general question. I'm hoping someone jumps in at some point to answer some of that, since I only get one question really. Thank you so much.
Delegate Chisholm.
Thank you, Mr. Chairman, and thank you for this report. I just want to try to get some clarification, because I remember all of this going down, and I studied it and looked at it and asked 1,000 questions at the time. But because when we're talking about the lab genomics test kits, those are the ones we bought from South Korea. And originally we bought a batch for, I believe, $9 million, of which we wired to a foreign country, I'm assuming. But when I'm looking at your report, I'm wondering, because what we had to do was then we had to ask for another $2.5 million, I believe, maybe $3 million, to get test kits replaced, because those were either completely faulty or didn't work, or we didn't get what we were promised. So then we had to go through another procurement process. And when I'm looking at your testimony and the PDF that you sent out, we talk about these 500,000 COVID-19 tests. Are we talking about the original batch, or are we talking about the second batch that we had to pay again for to be sent to us?
This is
So were there questions ever asked as to where the first batch went, what was wrong with them?
So if I might defer this question to Joe McWilliams, but I believe the first batch was returned, but Joe, maybe you can speak more on that.
Yeah, that's correct. The first batch of 500,000 was returned, and the second batch of 500,000 was then provided.
Delegate Bagnell.
Thank you, Mr. Chair, and thank you for this presentation. I think you're getting the sense of our frustration, because this committee and the COVID response task force were raising these concerns throughout, and at points where we might have pivoted, we didn't get a response or even get an appearance. So to Delegate Kittleman's point, can you give us any sort of historical context to where we were using emergency procurements at the level and at sort of what started out as a catastrophic event and eventually I think became an emergency that was more managed. But so we just have a little bit of context for the efficacy when we're using emergency procurements in a catastrophic event. And if it is still within our means to adhere to these policies, if they are adaptable enough to the level of emergency.
Well, I think your question, if I may, is similar to Delegate Kittleman's, and that is that, and the answer to that is no one expects an emergency to last 2 years or 3 years, or this at this point, I don't know how long it's going to last. So no one expected this to last as long as it did. And I don't think, I wonder if the regulations and state law and the statute was really intended to cover an event that would go on forever. I mean, seemingly now it's going to be years. And I just don't know. And maybe there is a different type of procurement for some type of catastrophic event. I think emergency procurements, I mean, many times we see them in the past, and there'll be, for example, if a state hospital's HVAC system goes up in the middle of August, and they have patients in the hospital wing, and they need to get air conditioning, and that's when you use that's when we usually see an emergency procurement, is when an emergency develops and it's immediate response to fix it, not something for 2 years down the road or 3 years. So I'm not really answering your question other than acknowledging that this is unprecedented, I think, what we're experiencing, and these regulations weren't designed for that, potentially.
Thank you.
Delegate Arentz.
Thank you, Mr. Chairman. Mr. Hook, this seems to be a recurring theme, and I appreciate the magnitude that we're talking about emergencies, but in the general world of audits and the audits that we've seen over the last several years, procurement's always been an issue. It's an issue in a lot of departments, and these types of things are happening across the board. How is this different than what we experience on an audit of another division, if you will, other than this is about an emergency? We always talk about accountability. We always talk about these things. What is the fundamental problem within the system that allows these types of events to even happen?
Well, I think that is, we do see, you're right. Many of our audit reports have procurement findings, various types of procurement findings. And you being on the Joint Audit and Evaluation Committee, you see them more frequently than many people do. But we also do see emergency procurements, but just, I think it's just, the COVID is just, the magnitude of the COVID problem is different. Now, we only looked at 15 out of 848 procurements. Could I say that all 848 were true emergencies that addressed a true emergency condition? No, I couldn't say that. And I don't have the resources to test all 848 of them. So, that's another question too, is that, perhaps all of these really weren't truly emergency procurements, but they were using the method because it was convenient, and because of COVID, it would not be challenged. Now, I don't know if there's any truth to that, but it's something that's in the back of my mind. I wonder, because 850 procurements are a lot of procurements using an emergency procurement method.
I understand that, but my question is, what is the difference between this and the other? Because it's an emergency, we see this across the board in every department. What are we doing to prevent that across the board? Not just with an emergency. This is something that we see in, I'm going to say 65% of our audits.
That's true. And I don't have any enforcement authority.
Okay.
So I can't, it's up to the budget committees or the legislature to take action as they see appropriate to compel compliance.
I'm not minimizing this. I'm not minimizing this by any stretch. It's just that we have a problem across the board is what I'm trying to ask you. And I guess that would come back to something we've discussed in the past. What are we doing to stop this?
Yeah, Delegate, I hear you every Joint Audit Committee hearing when you ask for accountability and has anybody been fired and who's held responsible. I get your frustration. I really do. And we have the same frustration ourselves with repeat audit findings. So I don't have an answer. I'm sorry.
Okay, thank you. Thank you, Mr. Chairman.
Delegate Krim, House Chair of the Joint Audit Committee.
Thank you, Mr. Chairman, and thank you to the leadership of this committee for inviting the audit committee to this hearing. Mr. Hook, I have a direct question about the Ernst & Young finding. That contract started out at $3.8 million. It's now at $47 million. Do we know if the what was expected in the $3.8 million contract has been delivered yet, or is this continuing? Did they underbid on what they thought the work would cost? Do you know any of that?
I can let Eddie, I think, has some answers, but this is, I don't think, a case of underbidding to intentionally get the contract. I think what it was, there was just a general sense from the health department as to what they wanted. They saw a demand and they needed a consulting firm to help them. So they quickly tried to detect interest in several companies, and Ernst & Young bid. But this is not a case of Ernst & Young, I do not believe, lowballing this contract and then hoping to get contract modifications down the road. I mean, Eddie, what was your sense?
I think that's correct. They really, MDH had a general sense of what they needed, but didn't know a whole lot of specifics. And, as I mentioned in my presentation, I think that's really the key why it was such a problem that comprehensive assessment wasn't more specific, because that was really supposed to drive, what were the services going to be provided and what was this thing ultimately going to cost. And I mean, it more or less looks almost like a blank check of we can provide a lot of people and do a lot of things, but, without more specifics, it's hard to really tell how proper that is.
Thank you, Mr. Chairman.
Delegate Hill.
Thank you, Mr. Chairman. If it's appropriate, can I ask a question of MDH?
Yes, you may.
Thank you. I was wondering, following up on Delegate Krim's inquiry, did you change the scope? Or was the scope more detailed than you thought when you put the proposal out? And the second part is, when the scope or whatever changed, what is the reason that you didn't rebid it and decided instead to continue and expand with the same contract?
Good afternoon, Delegate Hill, members of the committee. Webster Gee, Assistant Secretary at the Maryland Department of Health. Thank you for having us today. Delegate Hill, to answer your question, yes, we did change the scope eventually. The initial scope was focused on the COVID-19 vaccination effort. In contract modification 3, we did change the scope of the contract to also include overall COVID-19 response efforts. And as to why, the question is pretty simple. I don't think anybody in the United States or on the planet could have anticipated COVID-19's twists and turns just in 2021, much less in the past couple of weeks. And so we took the actions necessary to ensure that Maryland is one of the most vaccinated states in the country. And EY was directly proportionate in helping us achieve that very remarkable achievement. And we thank the people of Maryland for stepping up and getting vaccinated.
And then the second part of my question, in other words, what we heard is that you bid a part of it, but you gave people 4 days to respond, whereas this was something you knew a few months on. It's just not clear why there was no competition as the scope changed.
And to be very clear, there was competition at the beginning. Towards the end, for the subsequent contract modifications, the basic principle here is these folks had the information, they knew what was going on, and we didn't believe that it would be either prudent or necessary to have a new set of contractors relearn to work and cause a break in the operations tempo.
May I ask a follow-up, Mr. Chair?
Last follow-up.
Thank you. And if this was not taken at the expansion before the Board of Public Works, why were they not asked to weigh in on this decision to stick with the current vendor?
All of the contract modifications were brought before the Board of Public Works. We briefed the Board of Public Works staff, and they have asked us other questions similar to the ones that you're asking, and we provided answers to them along a similar lines.
Thank you, Mr. Chair. Thank you, Mr. Yee.
Delegate Sample Hughes.
Thank you, Mr. Chair. Good afternoon, everyone. This question is for the department. It's just one basic question, but in the report, it indicated about 475,400 masks unaccounted for and not being able to justify their location. Given the fact the governor is, stating the 20 million masks for the state are going to be distributed, what confidence can we have that the department is prepared and can account for those items and that they're going where they are supposed to go? This committee is very much concerned, given the fact that we know that masks are a priority, but we're just very much concerned that this is yet again an issue with the department. And we just want to know, what have you done? What are you doing? Have you put in additional staff to address this? But accountability for 20 million is a lot more than looking at this 400,000 mask issue that has been raised today. So if the department could respond to that, I would greatly appreciate it.
Thank you for your question, Madam Speaker Pro Tem. To answer your question, we took most of 2021 as we were asked by the Baltimore Convention Center to vacate the premises and to deconstruct the field hospital there in the summer. So as part of our process, we leased and the Board of Public Works approved a new warehouse in Curtis Bay. We took the opportunity to centralize and redistribute all of our purchased personal protective equipment, or PPE, and we believe that now we have a better accounting of our masks, and we are using the state Web EOC platform for resource requests in order to satisfy the current initiative to distribute 20 million KN95 masks out to Marylanders.
Okay, so Mr. Yee, you have the physical location, but did you put in additional staffing? Staffing is a shortage in our agencies across the board, but is that something that you put in place to account for those physically?
Yes, prior in 2020, the PPE was a little bit more scattered, and then we took the time to, over 2021, to consolidate and to more properly organize all of the PPE inventory.
Okay, you didn't specifically give me numbers, but thank you, Mr. Chair.
Thank you, Delegate. Mr. Hook, if I may, as we consider whether additional legislative oversight or statutory remedies are needed, are you aware of a source that we could look to for, model law or what other states have done to address the issue of emergency procurement?
I'm not aware, but I do think the Office of Program Evaluation and Policy Analysis might have already done something like that at one point. That's a sister office of ours in DLS. They might be a resource in that area. We ourselves, Eddie, we haven't done any kind of detailed evaluation nationwide of these types of statutes, have we?
No, we haven't, but I believe you're correct that report I referenced earlier from OPEGA does include some comparisons to what the law is in other states.
Now, Mr. Hook, today you spoke and you said you were not speaking officially, but you talked about a time limit on the length of emergency contracts, and you talked about competitive procurement upon renewal. Is that correct?
Yes. Yeah.
Fine.
Yes.
Fine. Okay. I want to thank you, speaking for myself, for the professional way in which, as always, you have approached this problem and today's hearing as well. Thank you so much.
Well, thank you. If I may, Delegate Rosenberg, I remember when you were on Joint Audit Committee as the co-chair. I go back as long as you do, and
that's a good way. Words. Certainly. Okay. There being no further business for this briefing, we are adjourned. And I would remind the HGO Committee that our bill hearings will start at 2:30.